Well, I know I've always been interested in nursing education and taking a look at how students learn in clinical. That was actually the purpose of my master's degree, taking a look at clinical learning and how students make sense of what they're learning in clinical as they become a nurse. And so when this opportunity came up to be an Nexen Scholar, I jumped at it because I did a little mini research project in my master's degree where I looked at how students look at how they understand the meaning of their experiences in a senior level practicum. So when I was teaching a first year level nurse in our new program, I was interested in understanding how students become nurses and how they learn to think like a nurse. And I know there's a lot of literature out there around critical thinking and decision making, but it was interesting to see how students put the information they're learning in theory into practice. And I was curious to know how students do that. So I thought if I did a research project where I was teaching students and used various different methods of feedback to understand how students put their theory into practice, it could help with how I teach and basically reframe, maybe even look at some of the questions that are most effective at having students recognize what theory they're bringing into practice, as well as help other clinical instructors with their teaching in clinical. Well, my research question, it was an evolving question. So when I started the whole Zettel program, I initially was looking at feedback, and particularly feedback that the instructor gave to students, but I recognized that that was too narrow scope because I understood that students get feedback from a number of different sources. So through my experience with Zettel and with the Nexen Scholars program and my residencies, I honed the question into thinking, in what ways do students link theory to practice in a first year clinical practicum? So my question was more of a what is project and describing the ways that students link theory to practice, as opposed to looking at a particular strategy and the usefulness of that strategy. So my question did change from the beginning to the end. It was an interesting process. I felt really comfortable with my question at the end because it made me kind of realize there was much more to the learning experience than what the instructor brings. And I have to incorporate that into understanding all the learning opportunities that students have in clinical. It's interesting because as students start out in the program, they're very concrete and they're wanting to know, what is it that my instructor wants me to show? Right, so they're very particular, they're very concrete and need to know exactly what it is that the instructor requires of them. So they basically write to what the instructor wants. And it's interesting, throughout this practicum, the students learned that it's not about what the instructor wants, it's about what it is they give to their patients. And so it was not so much around what it is that I need to be in order to be a nurse. It was more around what it is I need to be in order to satisfy the needs of my patient. And so what some of the students, even when this practicum, learned about themselves around empathy, around understanding the other, how they relate to others, communication, the difference between therapeutic and social communication, the communication they have with their peers, and the communication they have with their patients, and the communication they have with other interprofessional personnel that they work with. There were a couple of themes that came out. It was interesting that students, they learned about how to communicate with patients, but they also learned about how to communicate with their peers and how to communicate with other people that they work with in a professional manner. And integrating some of that. So as much as we had assignments that really helped them integrate this, what they found in the final interview in terms of what they learned was so much more around understanding the nature of their patient's experience and recognizing what it was that they had to do in order to be with their patient. Doing this project made me more aware of those contextual cues that students rely on in order to be able to self-regulate and understand what they need to do. So initially, students relied on the assignments to sort of get them through the experience of clinical. But it was interesting at the end where they relied more on their reflection on who they really are with their patients and how they need to move forward to essentially continue that self-awareness and professionalism and how they communicate with others and their patients and their families. You know, I was so impressed with the Scholars program. I had the support. I had a small group where there were 3 or 4 of us. Each of us had our own project and our own research question, and we used each other to give feedback on our research question, our data collection, and our analysis at the 3 different residencies that we had throughout the program. And we also had mentors that helped us with some of the questions and took us through some activities to really hone in on what it was that we were wanting to research and how we wanted to do it. So it was really helpful to learn about other people's projects on an interdisciplinary level, because many other people involved with the Nexen Scholars program weren't just nurses. This Nexen Scholars program was a stepping stone to think about other aspects of my teaching practice. And now I'm looking at how I teach pathophysiology and pharmacology in a clearer, more concise way for students to understand and apply to their clinical practice. So essentially, still linking theory to practice, but in a different course in our program. It's been a great program. It's been a great way. I know that I started the Nexen Scholars program in my 2nd year here as full-time faculty. My 1st year was trying to get my feet wet and get understanding around my own role within my faculty. But becoming involved with the Nexen Scholars program helped me kind of orient myself to the university as a whole and understanding the resources that were available to me as a faculty and how I could be a resource to other people in the university as a whole.